Hi, this is Dr. Simcha Y Cohen. We're talking about the treatment of ADD, specifically my method, attention deficit difference. I stress the word difference because that's really what it is. Why is this important? And why is it essential that we refer to it as a difference, not a disorder? Well, because if I know that I'm short and I accept that I'm short, I may feel bad about it, but eventually I'll get used to the fact that I'm not going to be on the NBA. If I aspire to do things that are not within my reach, that's where damage happens to the person's psyche. I knew a kid who was around 4'11", 4'12". He hadn't experienced his growth spurt yet. And he had very irrational aspirations of being on the NBA. He was in his backyard shooting baskets for 3.5 hours. Yes, 3.5 hours. And he made 3 baskets. Now, my problem isn't with the fact that he had irrational aspirations. That's something I understand children will have. My problem is the fact that his parents watched him doing this and didn't stop him. Now, there's something wrong with that. They need to go out and they need to explain to him, listen here, sweetie, you're a great kid. You got a lot going for you. But the fact is, you just haven't grown yet. So your aspirations for the NBA are not exactly realistic. So spend your time reading, writing, doing other things that you're good at. Save the basketball for the Shaquille O'Neals or the Kobe Bryants. What am I saying? I'm saying by us telling kids who have difficulty controlling themselves, have impulsivity problems that are neurologically based, what we're doing essentially is we're setting unrealistic goals for them. And we're putting them in a position that they're going to get frustrated. That's not fair. I'm not telling you we should compromise education. They have to be educated. I think we need to let them know there's certain things you can do and certain things you can't do. Now, in my treatment, I have certain forms which kids fill out, which they set up for themselves, what they can do, what they can't do, and then there's a third column of what they must do. Now, when there's a conflict between what they must do and what they can't do, that's what we work on. And we work on finding methods of doing it. The understanding is that metacognitively, meaning giving them the understanding of what they're dealing with, will help them. It will give them the ability to overcome. When we don't, and when we lie to them, or when we hide from them the condition or the type of brain that they have, what we're doing is we're setting them up for a terrible, terrible feeling of inadequacy and a feeling of repeated failures and repeated blame for things that they don't know that they did. And one of the symptoms that we need to stress is the fact that impulsivity really causes a child to do things they don't really remember a lot of what they do. Not because they're not conscious, but because they're so engaged in the moment that they don't pay attention to the detail of what they're doing. I know it's hard to believe. And many stories. I have stories of kids who have seen videos of themselves and they flip out. They say, like, I can't believe I did that. I had one kid that started to cry and he said, I really must be crazy. And the answer is no, you're not. You have an impulsivity. You have a lapse. So you know what? That's okay. But when you get blamed for it and you're told that you meant to do it, how many times do you say that to a kid? Well, if you've done it so many times and you're not listening to me, you must mean it. Or you don't care about me. Or you don't care about my feelings. I had a child that hurt their sibling. You don't care about your sibling. When a child hears that, the feelings that they have are terrible. Why would they say such a thing? Why would they think that I did this on purpose? I would never do that on purpose. But for a parent or an adult who doesn't understand the nature of the true neurological difference of ADD, so they think that the kid's doing it over and over again. They must mean it. Answer is no. They can't help it. So we need to really give them the benefit of the doubt. The understanding that it's a neurological deficit allows us to do that. One of the most important things for the children and the adults that comes from this is, in the words of one of my clients, it's like getting $1 million, because now I know I'm not emotionally disturbed. He thought he was crazy. He really thought he was crazy. But now he knows he's not crazy. He's got a neurological difference. Not so different than someone who has a right-hand, left-hand situation. But we accept left-handed people. And we understand that they have a difference in their brain. We need to start accepting people with ADHD too. And realize they have a difference in their brain. And we need to begin to accommodate them and help them with their behaviors. And therefore, they will feel better about themselves. Most of the problems that emerge are not from the symptoms. They're from the emotional ramifications of repeated failure. This is Dr. Simcha Y Cohen. This is a series. Thank you very much.